Okay. Hi, everyone. It's Dr. Conlin. Hopefully, this recording will work out. Um, so, I'm sorry about canceling class this morning. All three of my kids ended up being sick, and with coronavirus of potential in this area, they're being advised to keep everybody home, even if they're showing signs of a cold. So, everybody's doing okay. So, let's see. I'm just going to go through this lecture. I'll try to do it quicker than I normally would in class. So, more like a webinar for you. Here are the learning objectives. These are from your textbook in chapter 8, and you can read through them on your own. So, we talked about pregnancy and then we talked about lactation. Now, and lactation focuses more on the mother's physiology and needs. So now we're going to talk about the baby. One key question that almost every new mother asks is, how do I know my baby's getting enough food? How do you know breastfeeding is working, or how do you know you're formula feeding enough? Well, the general rule is weight gain. Weight gain is really critical during infancy, and it's a main nutritional assessment marker that we monitor. So we look at weight gain. We also look at wet diapers. If a baby is drinking enough milk, then they're going to have output as well. So approximate rule of thumb is 6 to 8 wet diapers per day. A lot of babies also show a consistent stooling pattern. Um, Sometimes after the first few weeks in exclusively breastfed infants, so infants that aren't receiving anything else than breast milk, because breast milk is so highly absorbable and usable, some breastfed infants don't necessarily have a stool every day, and that's normal. In formula babies, you might see stools every day, but you still might not. So that's normal too, but usually some sort of consistent pattern emerges, and mothers can readily identify that pattern and then share that information with their providers. Um, if breastfeeding is going well, then audible suck is heard from the infant. You can see an infant sucking and swallowing, and usually you can hear it. And importantly, a woman's breasts feel like they're draining when the baby's feeding and filling back up in between feeds. If a woman is frequently getting engorged, that's a sign that her breasts aren't getting fully drained. And we know that we need those feedback signals from the breast being drained in order to produce more milk. So draining is really important for milk production and also to avoid engorgement, which can lead to infection and mastitis, which is very uncomfortable. So I really like this chart. It shows diapers of the breastfed baby. Looking at a baby's poop and pee can help you tell if your baby's getting enough to eat. So it shows that I briefly mentioned the word meconium in a past lecture. That's the baby's first poop, and breastfeeding, taking in the colostrum helps babies pass this stickier poop. And then by day 3 or 4, the poop usually turns a greenish color. And then by day 4 or 5, it turns yellowish. So in addition to seeing the milk itself change in color and volume, you also should see the baby's stool change in color or volume, and it should proceed through these stages. This is pretty hallmark. Let me see. And then once it reaches this yellow, a breastfed baby's poop will stay yellowish. Some people say mustard-like. Sometimes it even looks seedy, just like mustard. For the remainder that it's receiving breast milk, and then when you introduce solids, the color and consistency will change based upon what food they're eating. What's normal too is poop can look watering. What's not normal? Sometimes illness, injury, or allergies can cause blood in the poop. This is not normal. And then here's showing how much. Babies make some large and some small poops every day. That's normal. Poops that are larger than a quarter count as a poop. By day 4, most breastfed babies make 3 or 4 poopy diapers every day. What else is normal? On day 1 or 2, some babies have orange or red pee. That's actually normal. By day 3 or 4, breastfed babies should make 3 or 4 wet diapers with pee that looks like clear water, though. So the pee should go, if it is red or orange in the beginning, the pee itself should also change to clearer water. And a wet diaper is as heavy as about 3 tablespoons of water. So, growth is highly dynamic in infancy. It's the most rapid growth experience at any age once a baby is born. So, we're using a lot of nutritional substrates during this time. We need the baby needs to have adequate calories and protein in order to support this rapid growth. So, adequate nutrition is essential. Nutrition supports normal brain development, impacts for future growth and development. And we've talked about in class how consequences can be lifelong. Both biological and environmental factors interact during infant growth and development. As the baby feeds, there are specific feeding skills that mark important developmental steps. They signal normal growth and development, but they also can signal developmental delays. So if a baby's not eating feeding skill marks, then this could possibly be a sign of developmental delay, although it is important to note that some babies are developing normally. They just might be a little behind, and we still wouldn't categorize them as a delay, but a significant delay, such as not being able to pinch their own food by 11 or 12 months, could indicate some sort of fine motor delay, which we'll talk about in a little bit. And nutrient requirements of term newborns have to be modified for preterm infants. And we're going to have a lecture on preterm infancy nutrition requirement because it's a very unique time of life. So there's a lot of attention that needs to be put into it. So it's going to be its own lecture after the formula workshop. And here's a picture of a baby on a scale. Note that for babies, because they can't, they can't even sit up for a long time, let alone stand. So we get recumbent weight and height for them, which is them lying down on their side. We use a special recumbent scale. You can buy them in a store for fairly inexpensive, so they are possible to have it at home, but just note that the weight is recumbent. So how do we assess infant growth? Well, we look at birth weight as an outcome, which we've talked about. Let's see. So for a full-term infant, which is 39 to 42 weeks, on average, they weigh about 5.5 pounds and are 18.5 to 21.5 inches. For preterm infants, this is infants before 37 weeks, they get categorized as normal birth weight, or similar to full term. They would also be categorized according to categories that we've discussed. So normal birth weight, low birth weight, very low birth weight, or extremely low birth weight. So review these categories here as well. Let me see, the full-term infant birth weight as an outcome. So I just wanted to mention that, however, before 37 weeks, the weight and the length can vary significantly based upon how early the baby is born and why they were born early and so forth. Another measure that we can look at, that's different than the birth weight itself, is the size for gestational age. So here we're going to interpret weight, but you can also measure length for gestational age and head circumference for gestational age. Baby's head circumference gets measured routinely as well because their head should grow proportionately as well. And you can follow their head growth on a growth curve, which we're going to look at in a little bit. So for gestational age, if we look at length, what is this saying? It's you would take the birth weight. Hold on.
Computers anywhere on the menu.
Oh, sorry, I'm recording. Sorry, got interrupted. I'll be right back.